President Trump has announced he'll soon leave hospital. He's tweeted, of course. He says, "I will be leaving the great Walter Reed Medical Center today at 6:30 p.m." he says, which is in about, 3 hours or so, give or take. Now, he also says that he's feeling really good. Don't be afraid of COVID, he says. Don't let it dominate your life. We have developed, under the Trump administration, some really great drugs and knowledge. I feel better than I did 20 years ago. Well, we are expecting any minute now an update from the doctor to President Trump. Well, his team of doctors, of course. They have been trailing that they will be coming outside. There we can see the microphones are ready. We have been hearing, to be fair, for a while that they are going to come out and deliver an update. And I suppose Donald Trump has, well, trumped them with the news that he will leave. That would have been their main announcement, I presume. But Donald Trump has made that announcement himself, which will be welcomed by many, not just in the US, of course, but around the world. The president be able to leave and head back to the White House. But several questions still remain about the treatment that he received and about his overall health. And those are the questions that we hope will be answered by his medical team outside the hospital there. Right, Lebu Duseko is also outside the hospital, and we can speak to her now. Lebu, so Donald Trump tweeting out the news that he is leaving.
Yeah, I think you're right. He did rather trump the announcement or the briefing from his own team. I mean, if we thought that Donald Trump was maybe going to take a different tone, I think his tweets this afternoon has shown that he is perhaps digging in terms of his approach to coronavirus. When he tweeted a video yesterday, he said he'd learned a lot of things and he'd learned them in the real way. He hadn't learned them from books. He had really gone through the experience. And he said that he had really learned from that. Today he tweeted saying, "Don't let coronavirus dominate your life. We've got some really great drugs under the Trump administration." And he said that he feels better than he did 20 years ago. Now, it is worth reminding people that there are currently in excess of 7 million cases in the United States and almost 200, well, more than 200,000 deaths. So that is something that's worth taking on board as well.
Lebu, well done for fighting against the traffic and the crowds there. I suppose that's actually quite revealing, though, because, of course, there have been people there all weekend. We've been watching them gather. But now, with that news, that will really buoy up those supporters.
Do you know what? Most of the supporters have been very, very good-natured. This afternoon we do have a gentleman next to us that's a little more noisy than what we'd experienced at the weekend. So I was doing my best to concentrate. But yeah, there really is a tremendous outpouring for Donald Trump here. And he acknowledged that in one of his tweets. He said that the media had been criticizing him for his drive past his supporters yesterday. You'll remember he came out in a car with his staff. They were wearing masks. He was wearing masks. They were masked as well. But lots of people said, look, that may not be the most sensible thing to do when one has coronavirus. And also that vehicle as well is designed not to let in any kind of, chemical or biological attack. So what does that mean in terms of airing? I mean, how do you keep somebody safe from a patient with coronavirus in a container like that? But Donald Trump digging in, saying that it's reported the media's upset because I got into a secure vehicle to say thank you to many fans and supporters standing outside the hospital. If I didn't pay my respects, the media would call me rude. So, this really does seem more like the Trump that we are used to seeing and hearing from on Twitter.
Yeah, and interestingly, of course, although he has his problems with the media, especially in the US, it was more doctors, wasn't it, who were expressing their alarm. In fact, one doctor from inside the hospital itself expressing their alarm with that little trip. But anyway, that aside, what questions do we now still need answering, Lebu, about his condition and about the treatment and about the timeline here?
Well, I don't think those people behind me have any questions, but many Americans will be asking really about the inconsistencies that came out from the president's team over the weekend. There were questions raised about the timeline, when exactly he was diagnosed with coronavirus. Also, how sick he actually was. His doctors went into quite a lot of detail about the fact that Donald Trump was given oxygen on Friday, but then when pushed as to whether he'd received oxygen when his levels dropped on Saturday, they said, oh, you have to ask the nurses. We'll have to ask the nurses about that, which seems incredible from his personal physicians. So yeah, there are a lot of questions to be asked. Also, there are people questioning whether the type of treatment that he has been receiving matches the kind of more mild symptoms that his team seem very keen to put forward that he has. I mean, they are really saying that he was taken into hospital as out of an abundance of caution. But there are many people, commentators on lots of shows, some of them are medical commentators, saying that the type of treatment he's receiving doesn't quite match that. So yeah, we'll hope that we'll be given quite a bit more clarity, if nothing else, a consistent message from them and the White House. Remember, on Saturday there was also inconsistencies between the message from the team and the White House Chief of Staff.
OK, thanks for that, Leba. We'll be straight back with you as soon as those doctors march outside the hospital there and give us that briefing. Thank you. Now, alongside that, there's been another significant development today. More infections have been reported among Donald Trump's closest advisors. White House Press Secretary Kayleigh McEnany has tested positive. She tweeted a statement saying she has experienced no symptoms, and she said she had no knowledge of another aide, Hope Hicks, testing positive before she was holding a White House press briefing back on Thursday. Well, this was that briefing. You can see White House staff there not wearing masks, members of the press, some of those also not wearing masks. Kayleigh McEnany does, however, say that no members of the press are listed as close contacts by the White House medical unit. Well, a growing number of people around the president, including his wife, Melania Trump, senior aides and Republican senators have tested positive for the virus. US media are also reporting that at least 2 other White House staff members have tested positive today. Now, many of the people who tested positive attended this event. You may remember this was at the White House, 26th of September. This was the event where Mr. Trump announced his nomination of Amy Coney Barrett as the Supreme Court Justice, his nomination. This event now is being scrutinised as a possible super spreader event. You can see people there not in masks, sitting pretty close together. OK, let's go to Washington now, and here's Larry Madowo.
This has been described already by some as an outbreak in the White House. The people who are closest to President Trump, Kayleigh McEnany, his body man, essentially his personal assistant, another close aide, Hope Hicks, several senators, people who were in his debate prep team, and other people who were close to him in the last few days have all tested positive, and the numbers appear to be growing if you consider Kayleigh McEnany and at least 2 other deputies in her office who have all tested positive. It speaks to how the White House has kind of had this cavalier attitude to mask wearing and social distancing, and it begins to show how serious this might be. So those protocols about COVID-19 safety are now again being scrutinized, and the White House in damage control mode to try and make sure that they don't create the impression that they didn't take this seriously enough.
Well, that was Larry Madowo in Washington. Not far from Washington is the hospital where President Trump is being treated, and any minute now we're expecting an update from the doctors, an update on his condition. We know, of course, that he will be leaving in just around 3 hours' time, but there will still be questions about what treatment he has received and what condition he is in, and we'll take you there live as soon as that happens. Right, let's go back a day now to Sunday, when the president temporarily left the hospital, where he's being treated, of course, and he drove past supporters and waved. Now, a White House spokesperson said precautions were taken and that outing had been cleared by the medical team as safe. But the president has been accused of putting his own Secret Service staff at risk. The president tweeted, "It is reported that the media is upset because I got into a secure vehicle to say thank you to the many fans and supporters who were standing outside the hospital for many hours, even days, to pay their respect to the president. If I didn't do it, media would say rude!" Well, President Trump's treatment has included a cocktail of antibodies, the antiviral drug remdesivir and the steroid dexamethasone, which is normally used when patients become seriously ill. So let's go through what they are. First, dexamethasone. It's a steroid that calms the immune system, which can become dangerously overactive in COVID-19 patients. And I will just interrupt that because we can see the doctors coming outside the hospital to give an update on President Trump.
Good afternoon, everyone. Thank you for being here. Over the past 24 hours, the President has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the President's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
Good afternoon. Just a brief update this morning. As Dr. Connolly mentioned, the President continues to do very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. A respiratory rate of 17 respirations per minute. His heart rate was 68 beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House medical unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the President received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House tomorrow evening. He continues on dexamethasone, and again, the plan for today is to continue to be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the Chief of Medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the President. Since the President's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities to include USAMRIID and RARE on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the President as well as his ability to transmit virus to others. Also, we have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the President can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
Thanks, Jason. I mentioned it Saturday, but I'd like to reiterate myself just how grateful the President and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we've received support from. And so long as everything continues on the track that we're experiencing right now, this time, as the President already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Discharged back to the White House when he was given steroids. You've said that he's still on those steroids. Those are medicines, as you know, that are usually given to COVID patients who are on ventilators or with low oxygen. So did you over-treat him? And if he's still on that medication, how is it safe for him to return to the White House?
So we send patients home with medications all the time. In fact, yesterday afternoon, he probably met most of his discharge requirements safely from the hospital. And he's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch physicians, nurses, PAs, logisticians, and the unit here, the team here behind me is going to continue to support us in that nature. Yes?
What infection control measures are you taking? And how was it safe for him to drive around in a cloth mask yesterday? And how is it safe for him now to return to the White House where there have been so many cases? How's any of this safe?
So the president has been surrounded by medical and security staff for days wearing full PPE. And yesterday, the U.S. Secret Service agents were in that same level of PPE for a very short period of time. We've worked with our infectious disease experts to make some recommendations for how to keep everything safe down at the White House for the president and those around him. We're looking at where he's going to be able to carry out his duties, office space, and I'll just say that it's in line with everything we've been doing upstairs for the last several days.
Can you tell us, please, on testing, can you tell us when he had his last negative test? Was it Thursday? Was it Wednesday? When do you remember when he had his last negative test?
I don't want to go backwards.
Contact tracing for people who are around him to know.
I understand. The contact tracing, as I understand it, is being done. I'm not involved with that. So.
Why did you begin the starvation that you leave, or was this something he pushed for?
No. So we try to get patients home and out of the hospital as quickly as is safe and reasonable. Every day a patient stays in the hospital unnecessarily is a risk to themselves. And right now there's nothing that's being done upstairs here that we can't safely conduct down home.
You said that 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal, and what are your plans for addressing that if it were to happen?
You're absolutely right. And that's why we all remain cautiously optimistic and on guard because we're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh of relief. But as I said, 24/7 world-class medical care surrounding him down there. We're not going to miss anything that we would have caught up here.
He's physically going to be in the White House, and what does that look like? How do you keep him safely quarantined?
I wish I could go into that more, but I just can't.
Doctor, why did you begin dexamethasone treatment?
So that has something to do. Yesterday we talked about that, the several little temporary drops in his oxygen, and we had discussed that as a team and elected to start it early in case that persisted or worsened. The potential risks and side effects we all discussed. We looked at the data and decided that we'd rather push ahead on it than hold and risk the opposite.
What about CT scans and chest x-rays? What have you seen on his
campaigning?
As far as travel goes, we'll see.
Mental status, can you talk to about whether he has any neurological symptoms? Does he have any side effects from his medications? Any fogginess from the virus?
No, I think you've seen the videos and now the tweets, and you'll see him shortly. He's back. Yeah.
Pneumonia or any inflammation in his lungs at all?
So we've done routine standard imaging. I'm just not at liberty to discuss.
So you're actively not telling us what those lung scans showed, just to be clear.
So there are HIPAA rules and regulations that restrict me in sharing certain things for his safety and his own health and reasons.
Share how many times, you said his oxygen dropped several times. Can you share how many times he was on oxygen? You said you checked with the nursing staff yesterday.
Yes. So he the 2 episodes like we talked about yesterday, and both times that he received a little bit of oxygen and recovered immediately.
Was that oxygen required?
No, it wasn't required. He wasn't short of breath. He wasn't looking ill. It was more of us trying to anticipate needs and see how he'd respond. And in both cases, it came right off. He didn't need it for very long at all.
You were on board Air Force One for multiple trips. Are you at all concerned about your own exposure and exposure to the medical team?
I am concerned, but as the CDC says, there are caveats for essential employees that as long as you continue to test negative, you remain symptom-free, and you keep a mask on when you're out and about, which we do inside the hospital 24/7, then you can carry on your duties. Yeah.
The president's an impatient man. Has he been itchy to get out of here?
The president has been a phenomenal patient during his stay here, and he's been working hand in glove with us and the team. And today got to the point he's holding court with those of us around him, the whole team, going over all the specifics, the testing, what the future is, and we have been back and forth on what's safe and what's reasonable, and he has never once pushed us to do anything that was beyond safe and reasonable practice that we all first wanted.
Medical team who recommended against the president leaving here and going back to the White House today.
Or
any White House staffers?
No.
The president said don't be afraid of COVID. Do you agree with that? Should we not be afraid?
I'm not going to get into what the president says.
His heart, liver, and kidney function was normal or improving. Improving, does that mean that there were effects, and is it all normal? Like, what's up with that?
Yeah, it's all normal right now. I would say he appeared to be a little dehydrated Friday. He was able to just drink and recover from that, and yeah, everything looks great.
Campaigning out in the country, what sort of things do you?
Yeah, so the big first thing that we need to do is that there is no evidence of live virus still present that he could possibly transmit to others. And that's what the infectious disease experts and some of our partners, military civilian entities, doing some of these advanced diagnostics just to see as soon as we can identify that. Routinely, we talk about a 10-day window, CDC guidelines, but we're checking him more routinely than just waiting 10 days. There's a possibility it's earlier than that. There's a chance that it's a little bit later, but we will know as soon as possible. And then we will look at him clinically. How are you feeling? How are you doing?
Why have you decided not to administer hydroxychloroquine to the president during his time here?
I'm not going to go into all of our debates about specific medicines and therapies. There are dozens of therapies that we were made aware of, that we considered, that we discussed and debated and looked at, the existing literature on. And this is the regimen we chose.
Hydroxychloroquine.
In terms of COVID, is he having some of the muscle aches? Has he lost his sense of taste and smell?
No, we were just talking about that, what symptoms he has left. And he's even the slight cough that he used to have, he doesn't really complain of at all. He hasn't ever complained of muscle aches. Yeah, he's up and back to his old self predominantly.
Next Monday, just to be clear, how long will he still be actively shedding the virus?
So this morning, I believe there was even an accounting by Dr. Fauci referencing the first 5 days of illness that people are most likely to shed live virus. There's a reason there's the 10 days is because most people by that time, after 7 days, most folks don't have culturable live virus. They put it to 10 just to give some extra space. It's never 100%, between everybody. So we'll see. I'm not going to put a specific number, but we look at that window is all I say.
Will the president be confined to his residence, or will he be allowed to return to the Oval Office?
We're going to do whatever it takes for the president to safely conduct business wherever it is he needs to do within the residence and White House.
And is he on blood thinners, and also has
You're
he
watching
been
Outside
using,
Source on the BBC.
Tylenol, Advil? anything
Oh,
to
that
bring
came
his
up.
fever
I would
down?
like to say he has not been on any fever-reducing medications for over 72 hours. Yeah, he's on a routine regimen of COVID therapy. I'm not going to go into specifics as to what he is and is not on, but.
This here that the president had a mild cough, some nasal congestion, and fatigue on Thursday. Now, back to my colleague Jen Jacobs' questionnaire. The reason knowing when the president's last negative test is important. For that reason, your words, what you said, and also for the contact tracing. But would you recommend it that, given those symptoms, that that the president go to that Bedminster fundraiser?
It's not up to me necessarily, the president's schedule, but I would say that it wasn't until after he returned that we really sat down, then knowing the news of the day, that we really dove into how are you feeling, what's going on.
Those were the symptoms he was experiencing on Thursday.
I'm not going to get into operations.
When was his last negative test, and what was his viral load?
I know everyone wants that. Yeah, I don't have his viral load. Those are some of the diagnostics that we're sending out that will really tell us when it's safe for him to get back out and around people.
What did you say when the last negative test was?
Any abnormal tests? Were any of his lab tests abnormal?
I'm not, again, HIPAA kind of precludes me from going into too much depth and things that I'm not at liberty or doesn't wish to be discussed. At some future point, maybe, but today, sorry. I think that's it. Yeah.
Thank you, guys.
Thank you.
Thank you.